Hi, Dr. Abed. We may start now.
Yep, go ahead. Shall I start then? Huh? Hello?
Yes, Doctor.
Okay.
Yeah.
Okay. Hello and good afternoon, ladies and gentlemen. On behalf of AOEMM, I would like to welcome all of you to this 13th webinar that we have organized in conjunction with the Asian Congress on Occupational Health, ACOH 2026. And for this afternoon, we are very very honored, very privileged, to have with us Dr. Shyam Pingle from India, who will be sharing with us his thoughts about climate change and occupational health. And just for information, as you can read from the slide that's shown here, that Dr. Pingle has a lot of experience, long and many experiences in public health and occupational health in particular. And he is presently the vice president of ACOH. And so without further ado, I'd like to invite Dr. Shyam Pingle to talk to us about climate change and our occupational health. But before we continue on, just a few house rules, which I'd like to help so that everybody gets a enjoy the session without any interruptions. First of all, can you keep your microphone muted? And then, of course, you stay focused for the session. And if you have any questions about the presentation at any time, please type it into the chat box, because we'll have a Q&A session at the end of the presentation. Okay. Now, if there are some information that's shown here that are confidential and which will be mentioned if it's confidential, please do not share this information outside of our webinar. Anyway, the session will be recorded by AOEMM, and we will put it up on the ACOH 2026 website. Now, for those who are from Malaysia, if you attend a full session, you have to we will register you for the MMA CPD points. So with all those rules in place, we will have about 40-45 minutes for Dr. Pingle to regale us, tell us about his concerns about the occupational health because of the climate change that we are facing today. So without further ado, Dr. Pingle, please.
Thank you. Thank you, Dr. Abed, for the nice introduction. And I also thank the organizers of ACOH for organizing this series of webinars, which has been a wonderful thing, which also gives us time to interact with people at ease. And it also builds up the tempo for the main conference to come. Thank you very much. May my slides be shared? Can I share my slides?
Yes, Dr. Shyam. Please do so.
So I think they were already shared. You'll have to remove the...
remove. All right, sure.
Yes. So, no, not yet.
No luck, yeah.
Yeah, it will come.
Oops. Here we go.
I think now my slides can be seen. I'll make them in full screen mode, presentation mode. Yes.
Good.
Okay, so very good morning to participants from India. Very good afternoon to participants from Malaysia. And if there are any others, then accordingly, whatever is their time. I hope there is no one from good evening zone. Yeah. So let me go straight to the agenda. This is how I intend to cover in next 35-40 minutes max. Introduction about occupational health and climate change, the impact, the need for urgent action, and what solutions could be there. Because we can't only point out the problems, we also need to have solutions. This slide from WHO, this picture, this very well explains how the environment impacts our health, what are the various factors, and what is the effect, how air pollution, chemicals, agricultural, built environment, everything, noise, etc., how it affects us. That can be seen in this picture. So what is climate change? Well, I know this is an August audience and I need not go into the basics, but climate change is a long-term shift in Earth's average temperatures and weather patterns, as we see. And now the pace has been accelerated. It is happening much faster now. That's why the concern is increasing. And when we burn oil, coal, gas, etc., the fossil fuels basically, and then we release greenhouse gases, mainly carbon dioxide and other gases. They go out and get accumulated in the atmosphere of the Earth. So we can call it as a blanket effect. As you can see here, that this is a blanket on the Earth, and the blanket becomes very thick. And as there are more and more gases which accumulate inside this blanket, naturally the heat will increase. That's what we face. So the same thing is happening to the Earth, and that is what we like to call as global warming. Well, climate change is not something which is very distant. It is not something which is just imagined or something is doing it for some nefarious purposes, but it is the reality. And it is the largest occupational health threat for the whole globe. I mean, it's even more than silica or asbestos, because there at least those who are exposed are affected. Here, everyone is exposed, so everyone is going to be affected. So that's why it becomes important. And then we have to also remember that gone are the days uh, of the 20th century. And now we are in 21st century. The patterns are different, the temperatures are different. And whatever we had decided earlier, whatever threshold limit values were calculated, whatever our systems were calculated, they were for a lower temperature. And now that the temperature, average exposure temperature is increasing, the absorption and other things will also increase. So we can say that those things may or may not apply today. And naturally, this climate change are going to be affecting workers more than the general population, because workers are exposed for a longer duration and they also are exposed at a greater intensity. Climate change will impact the workers, workplaces, everyone, and it will cause this displacement and migration, and it will actually lead to unemployment, it will lead to loss of productivity, and overall, it will affect our things very negatively. So outdoor workers are obviously affected, but indoor workers are also not spared and they are also at risk. So we have to remember that. And it also affects the quality of our work and potential for the decent work. We all know ILO has propagated decent work for everyone, and we know the characteristics also. But that decent work is becoming less and less possible, more and more challenging. And one of the reasons for that is climate change. Climate change also increases or exacerbates the chronic diseases which people may be facing. And but climate change also can be used positively if we have mitigation and adaptation policies that we use, if we are resilient, and then climate change can also create new jobs. There can be synergies between decent work or healthy work as we want, as well as the climate change policies. Uh, provided we have appropriate policies. Now, climate change is a social and occupational risk because there are going to be more accidents, more occupational diseases, and more work interruptions. Remember, work interruptions, as the temperatures go very high, you have to stop work or face the hazard to the health. Similarly, there will be rising pressure on the insurance systems, on the healthcare systems, and on the compensation schemes also. And the global working time is reduced because of this. Economic output will be reduced, and there will be disrupted schedules, productivity reduction, unsafe conditions. And again, what is important is this growing inequality in protection for vulnerable workers. We'll see who are the people who are more vulnerable. But that is definitely going to be a matter of concern. Construction is by far the most, it's a major industry. It's also an industry which is commonly exposed to hazards of climate change. That's why I put a separate slide on that. So there are direct risks like heat stress and dehydration. Then there are extreme weather events at places. There can be cold, severe cold also. Sometimes there can be severe rains also. We'll see that as we go ahead. Air quality, ultraviolet radiations are becoming very important, especially in European countries or in the countries where the skin is more susceptible and the disease patterns are changing. Chemical and biological exposure is also increasing. There are also indirect risks like compressed schedules, psychosocial stress, unequal protection. You can see the slide. And energy transition, there are new industries which are coming up. So all these things are there. Now, whenever we talk of climate change impact, it is basically there are eight ways we can look at it, or 8 factors or agents as we will like to call them. So first and foremost is extreme heat and cold. We'll have a look at the heat in little details. Then there is severe weather. So that means severe cold is there, severe rains are there. Then there is air pollution. There are changes in the vector ecology. New vectors are coming up, so we see new diseases, not only malaria, but also dengue, also some encephalitis. So many other things are coming up. You all know them very well. Then allergens are increasing. So there will be increasing allergies, which will again add a load on the respiratory system. Then the water gets reduced and the water quality gets affected, and that also affects us adversely, both at the workplace as well as in the general population also. Water and food supply is also getting affected. And of course, the other environmental things are also important. Now, this is nowadays any summer, and this kind of a slide will appear in my newspapers. The March has just started. So last March, they said this March is hottest in 122 years. And I don't know what is going to be the headline in 2026. And actually in India, summer months are supposed to be the month of May and June. But right in the month of March, we have started. In fact, when we were planning the International Commission on Occupational Health, ACOH 27 conference, we were advised to do it in March because that is more convenient time for everyone because Ramadan is over, financial year has started and everything. But when we looked at the weather pattern, we realized that March at times can be very hot. And since January was not possible, we zeroed in on the month of February.
Hi, Dr. Shyam.
Yes.
Before we proceed any further, can you dismiss the notification below by click the hide?
No, what?
Dismiss click hide beside stop sharing.
You're talking of this?
Yeah, correct. Correct. You need to click hide.
Yeah, can you click the word hide
Oh, yeah,
on the
there
right
is this
side?
hide.
It's done.
Yes,
It's done.
All right. Thank you so much. Okay, Peter.
Thank you, Shakira.
All right.
Then there is heat vulnerability. Last year, there was a tragedy, we all know, in the city of Mumbai, wherein many people, they had gone there to listen to someone in the morning, a lecture in the morning. It was in the open grounds. And though it was a morning time, lot of people suffered dehydration, there were injuries, people fainted, there were even some unfortunate deaths. So heat vulnerability, because different people are vulnerable for different things. And this, again, this chart from WHO, it shows the physiological factors and exposure factors, which will be for which like infants and children, pregnant people, older people, etc. are more susceptible. So this is in the city of Ahmedabad, where we had taken a project. We had a heat action plan project. So from there, we collected some data and we found out that when the temperatures are high, the total recorded deaths are higher. When the temperature, now it's very difficult to find cause of death, especially in public hospitals in India. Because people report from various places and the reports are quite late. But the reports in the month when, or in the weeks rather, not months, where the temperatures were very high, you can see it here, there, then we had much higher reportage of death. So that means it definitely affects the people. So extreme heat is it was reported by ILO that 2.09 million disability adjusted life years, or DALYs as we call them, they are lost every year because of exposure to extreme heat workplace. And there were nearly 19,000 deaths in this period every year. Then outdoor workers like construction, agriculture, delivery. Delivery has become a big employment nowadays, utilities, etc. And then there are indoor workers who are exposed to heat like warehouses, kitchens, foundries. They are more vulnerable. Then there is loss of productivity, as we have already discussed. There are increased injury rates, increased miscarriages and stillbirths among pregnant workers. This is all data which has been reported in various papers, various research projects. And then the rising night temperatures lead to lack of recovery sleep. And therefore, there is a 10 to 15% increase in workplace injuries whenever night temperature or the minimum temperature increases 1 degree centigrade. We all generally are aware of the maximum temperature and we monitor the maximum temperature. But many times we ignore the minimum temperature. The minimum temperature is also very important and it is the cause of a lot of morbidity. And then, as I have already mentioned, the occupational exposure limits for chemicals, they become more dangerous as heat accelerates absorption through both skin as well as lungs. Then we are seeing a plethora of chronic kidney diseases. They have been reported from many states, many places, many countries, whether it is from Brazil or India or Africa, many places. Chronic kidney diseases of unknown origin are being reported in larger and larger numbers. In fact, there is an explosion like that. So maybe there is sugarcane, brick workers, rice workers, etc. They suffer repeated heat dehydration, which may be the primary driver for this chronic kidney disease. Then UV radiation intensity is also increasing. And outdoor workers naturally face a higher rates of skin cancer, which we see more in white people because of their vulnerability and susceptibility. Pregnant workers, as we know, are especially vulnerable. Then wildfires and urban heat islands, as we see even in California. Dust storms, as we see at many places, they're exploding. Occupational lung diseases. Then respiratory crystalline silica mixed with wildfire smoke creates, which are a cocktail which is very highly toxic, as we see. Then these are some facts and figures related to heat exposure. I think I already more than 2.4 billion workers are exposed to heat. Annual heat-related occupational injuries are 22 millions and deaths are 18 or 19,000. Then global workforce productivity loss is 2 to 3% for every 1% increase in heat above 20 degrees centigrade. And then there are also long-term projections where they say that by 2030, that is in next 4 years, the loss of global working hours will be by 2.2%. And there will be significant productivity loss when the temperatures are high, and 50% of work capacity as compared with cooler conditions will be affected. So that was about heat. Then severe weather, there are heavy rainfall events. There is severe cold also. We are having cold waves, we are having heat waves, and then heavy rainfall events. These are very important because what is happening, you can see this particular table. Here you can see, this is of course of Indian cities. Now here, this is the decadal frequency of heavy rainfall events. That is the days on which there is heavy rainfall beyond a certain threshold level. So what you can see that these numbers are increasing. Baroda 17 to 34, 21 to 25, 15 to 21. You can see 13 to 17. At Surat 39 to 101. That means these are the days on which there is heavy rainfall. No, total rainfall in the season is not increasing, but on specific days there is heavy rainfall. What it means is on the other days there will be deficient rainfall, and this heavy rainfall will also lead to floods. So again affecting the people adversely. So that's why this becomes important, and this has a significance. And these numbers are increasing. I'm sure these things are being observed in other countries also. So coming to air pollution next to heat is air pollution. It is, we all know the effects of air pollution very well, even without climate change also. Premature deaths, cardiovascular diseases, respiratory diseases, heart attacks, asthma, lung cancer, dementia, even neurological problems. All these are because of, these are increasing because of air pollution. And then the most important environmental cause of mortality and morbidity is being attributed to air pollution nowadays. They say that life expectancy has been reduced by an average of 3.2 years. On one hand, we are trying to increase the life expectancy by research in medicine, by providing good nutrition, by increasing the awareness. On the other hand, this air pollution is affecting adversely and our effects are negated. So outdoor pollution causes 3.7 million premature deaths. It has been reported, and again, you can see the various percentages also. Unfortunately, 88% of air pollution deaths are in low and middle income countries. I'm sure today, most of us who are attending the webinar, a great majority is from low and middle income countries. So we have more risk and a higher risk than exposure. The vector ecology is also changing, and therefore vector-borne diseases. There are new regions and the seasons are getting extended, and there are new problems like Lyme disease, chikungunya, encephalitis, West Nile virus. They are increasing. So workers in landscaping, forestry, and utilities are more exposed to these, and therefore they are frontline victims. Then these floods, hurricanes, and storm surges also destroy the workplaces overnight. And then the hidden killer is mold in the flooded buildings. We only look at the water recedes, but the mold is there, and mold grows in the buildings, and that affects the health of the people who return very adverse. Then there are various allergens which are increasing, like asthma, respiratory allergies, they are also there. And then there is water quality impact like cholera, leptospirosis, and other diseases. We all thought that cholera has been eradicated, but 2 years ago, the cases of cholera were reported from some countries and even in India. The water and food supply also gets impacted, and that naturally leads to malnutrition and diarrheal diseases and other diseases which may be there. And then there is overall environmental degradation because of climate change. There is forced migration. Then, of course, though may not be because of climate change, but there are civil conflicts. There are wars as we see them. Ukraine war is still ongoing. And now we also have problems in West Asia. And all this is going to have a mental health impact. So our mental health will be affected and is already being affected, not will be, it is being affected. Then migrants and gig workers, they are the most exposed and most, you can say, victims of the climate change. So migration is, of course, a global phenomenon, and there are globally, they say 281 million migrants in 2020. Now the number has even increased. So 50% of the working population globally is either underemployed or unemployed. Unemployment figures technically may not be very high, but underemployment figures are very high because people get only seasonal employment or only part-time employment. And therefore, we see that people are going from low middle income countries to high income countries. And naturally, they are the vulnerable people. Gulf states are also have a large proportion of migrants in precarious jobs because these migrants, they always get precarious jobs. The jobs which they get, they are known as 3D jobs. That is dirty, dangerous, and demanding or difficult jobs. And now add the fourth D of discrimination to that. So migrants, they get jobs where they are not properly covered, whether they are not compensated, whether they don't get enough protection, and they face a lot of discrimination. And this is increasing because of climate change. Then these people are also excluded from policy and benefits. There are higher deaths and injuries among the migrant and gig workers. And they have very less access to heat relief, clean water, or even workers' compensation, especially in case of climate disasters whenever they're there. Mental health, as we have already mentioned, mental health toll is also increasing. There are farmer suicides which get repeated. And naturally, if the crop is affected and he's in severe financial crisis, people will unfortunately think of suicides. And that is before suicide comes depression, and before depression comes lot of mental health problems, which are much more widespread, heightened anxiety, stress, emotional exhaustion. And whenever there are climate change issues or wherever there are events, after that, we also see post-traumatic disorders, psychological disorders are also seen. Then there is a survivor guilt among the disaster response workers. There are so many things which give rise to the mental health issues. So WHO is very nicely summarized in this diagram. The vulnerability factors which are there like demographic, geographical, socio-political, gender equity, etc. And then there are health risks, there are exposures which are there, what are the health outcomes and what are the health systems and facilities, how they are going to get affected. So in nutshell, this particular slide summarizes all that we have discussed so far and also a little more than that. So there is a need for urgent action, as we say. The workers' health must be placed at the center of every climate policy, which is currently not happening, but that has to happen. The climate impacts they are not only natural disasters, but they are also expected or foreseeable occupational hazards. So since we expect them, we anticipate them, we have to take efforts to either prevent them or to mitigate them. The climate clauses like paid extreme weather leave, right to refuse dangerous heat work, early warning systems, and occupational health research on these new hazards is very essential and is urgently required. Of course, we have the technology. It's not that there is no technology. We have cooling PPEs. There is remote monitoring that is available. So less people will be exposed to climate hazards. Then there is predictive heat alerts. They can be there. We had, as I had mentioned to you, that we had a project, heat action plan project in Ahmedabad, where we envisage these predictive alerts by getting what is going to happen and what advice can be given. And these alerts were disseminated by the municipal corporation, by the local government to all the people through, because now everyone has a smartphone or at least a phone. So through SMS and other measures, it is also always possible to reach the people quickly and effectively in case such a need arises. But then the adoption is not as much as it should be. And many industries, unfortunately, they think it is cheaper to pay the fines rather than take the actions to protect workers. So that is something which is very dangerous. We already possess the solutions like worst case cycles, cooling PPs, biological monitoring, early warning apps, etc. We'll look at that later. So there is a need for urgent action. And what we feel that implementation is a political choice. It's not a technical problem. It's a political choice. The leadership has to, the governments and the leadership, everyone has to take a stand and say that, yes, we will do it. And then a lot is possible to be done. Now, some countries have started taking climate actions. They're taking some practical things. So these are some of the reports from some of the countries. Of course, this is not to say that these actions are sufficient, but this is at least a beginning has been made. In Spain, there are national heat and weather risk measures. They have been outlined. They are being implemented as a national policy. Qatar, after the football tragedy and disaster, they have introduced heat stress regulations for outdoor workers. In India, we have heat action plans. So we started in 2010 with the heat action plan in Ahmedabad. Now, in this last 10-15 years, it has spread all over India, and almost 22 states are implementing heat action plans in various cities which are vulnerable to high heat. Then in Australia, we see heat stress management in work health and safety activities. In Germany also, they have amended the rules, and under occupational safety rules, there is workplace heat protection that is being provided and that is being mandated. So these are some of the practical actions which have started, albeit they need to be expedited. All countries need to adopt it, and it has to be on a much, much higher scale than what it is present. At Ahmedabad, we also undertook many climate change projects. So as I already told you about the Ahmedabad Heat Action Plan, which was very successfully implemented in the city of Ahmedabad, and it was adopted by National Disaster Management Authority of the country for countrywide application, and the government is supporting it. And then we also had Ahmedabad Air Information and Response Plan. Like the Heat Action Plan about air pollution, we also had air response plan. Then we have done some studies for occupational heat exposure for traffic police in Ahmedabad as well as in the state of Gujarat. And then we recently completed an India Health Co-Benefit study. That is, if we take some measures, then what will be the benefits in terms of effects of climate change? And if we do not take measures, what will happen by 2030? And we found that if we take measures, then it is possible to reduce many hazards and effects of climate change over a period of time. So that was a modeling and some data collection and other things were involved in that study. I'll share the details at some other time, next occasion maybe. Now coming to the solutions, as I said in the beginning itself, that we have solutions and we need to have them. So we have to promote the actions which both reduce the carbon emissions as well as improve health of the people. So we need to build better. Built environment is also very important. And like we see air conditioners everywhere. And what they do, they cool the houses, they cool the offices, but the heat is thrown outside. And when you walk on the road, you see hot and humid climate. So more people are exposed than the people who are protected. So therefore, we have to find proper ways of building better and having better construction, using better materials, which are more climate resilient and more environmentally sustainable. And then we also have environmentally sustainable health systems. We'll come to that. Then we need to protect the health of the people and especially workers from wide range of impacts of climate change. For that, we can take different actions. And then advocacy and partnerships or collaborations are very essential. Now, advocacy is very important. We all have witnessed it, that COP24, COP26, COP27, all this is going on, and suddenly somebody comes and says there is nothing like climate change. And the efforts get a big setback. So that is the reason advocacy is very important. So advocacy and collaborations, we can learn from each other and we can transfer the technologies. Then we have to assess the heat vulnerabilities and developing heat health leadership and raising awareness. So what are the health vulnerabilities and we have to also raise awareness, keep on raising the awareness at all levels, whether it is at the level of consumer, users, policymakers, medical providers, everyone. And then we need evidence. So therefore, we need monitoring, we need research. And this research needs to be disseminated without any further delay. And of course, there is a shortage of trained personnel. So we need to go in for capacity building, especially on climate change and human health. Because that is what, when we started our heat action plan, the first thing we realized is people, even the doctors, were not as much aware as they should be. So we had to take special efforts for capacity building and focus on them in the initial stages itself. So we need to do that for climate change. Then there are various mitigation measures which we need to take. There are work rest cycles. There are cooling PPs, personal protective equipments, like there is a cooling helmet. There is a cooling jacket. So all these things can be done and provided to the workers who are more vulnerable and who are more susceptible. And it should be made a part of our workplace guidelines. Then biological monitoring, the early warning apps. So like we have in India, we have introduced a Suffer app, which gives early warning for pollution. Then we, from our IMD, the meteorological department, we get the predictions for the next 5 days. What is going to be the prediction, heat prediction, so that we can prepare ourselves properly and we can plan our work appropriately, especially when it is going to a very high level of 45 degrees centigrade or whatever. At each place, the level will be different because it depends on what is the ambient normal levels and how they are increasing. So the difference is important, not only the absolute number. So these early warning apps are already coming up and more of them are required so that more people can be accessing that. Then the wet bulb standards need to be enforced. So enforceable wet bulb standards need to be developed, needs to be reiterated, backed by the research and science and documentation, and they need to be enforced at the workplace. That at a particular level, you have to stop work, you have to reduce work, there have to be work rest cycles. If you do this much work, you have to take this much rest. All those things, we all know them very well, but that needs to be implemented. Then there is a technology, as I said, that cooling PPs are available. Remote monitoring is possible. So at many places, we can fix the cameras and people can sit in the control room and they can observe that, so that less people go to the field without compromising the quality and without compromising the safety of the work process. Predictive heat alerts are being issued and they should be very widely disseminated. The technology of mobile phones should be a very helping factor to all of us, all the governments and civil administration for this purpose. Then there can be engineered ventilation at various places. And wherever there's a lot of heat, we can have water fountains, we can have this water mist and other things. Now, I had an occasion in the month of July to go to the Global Expo at Osaka. And there, what I found was they had provided at frequent intervals, very short intervals, there were these stations which were available wherein you would get water mist continuously. And those who had exposures, they can get some rest there. So these kind of things we will have to provide. And these are possible and available. So there is again, what is most important is a call for climate clauses. So in our policy, in our law, in our rules, in our SOPs, the climate clauses have to creep in. They have to be included. They have to be incorporated. So they should be a mandatory part of every labor contract, every SOP, which may be there at the workplace. So there will be enforceable wet bulb standards, as we have discussed. So mandatory work rate cycle should be there based on real-time environmental monitoring, not from some table, but what is happening, what is there today, depending on that, it should be real-time. Then the right to refuse. If there is life-threatening heat or other conditions because of climate, then workers should have a right to refuse and they need to have a legal protection for that. Then, as we said right in the beginning, this occupational exposure limits or threshold limit values or whatever, they need to be updated. For that, we need extensive research and validation. And whatever are our current values, they need to be updated and made realistic. Then universal health access is of course important. So for that, we need funding for occupational health research, and we need protection for informal workers, migrant workers, and gig workers who otherwise may not get the protection which a regular worker gets. So, and then their exposure is higher. So that is important. So again, this diagram shows very nicely building climate and resilient health. So assessing heat impacts and health co-benefits, climate change and health planning. So we need to plan for climate change and events which may be there. Then we need money. There's nothing can be done without money. So we need this financing climate change and health is important. The governments have to provide resources, and we need to implement the various interventions which will be there and monitor the climate change and health progress. So that PDCA cycles, we always need to evaluate whatever we are doing and whatever is the effect of that. So to summarize, I can say that climate change is not distant, but it is here already. Whatever the politicians may say, climate change is already here. And we all know we are all seeing them. 3.6 billion people live in the areas which are highly susceptible to climate change. So that is almost half the global population. And between 2030 and 50, climate change is expected to cause 250,000 additional deaths per year. Remember, additional 250,000 deaths. And these deaths are of young people. These deaths are of the people who are working. So therefore, deaths will be much higher. It's not that only those who are in compromised health are succumbing, but also the young people. Then there may be areas with weak health infrastructure, especially in developing countries, low and middle income countries, which are not able to cope. So they need to be strengthened. Especially, we need to find out some smart solutions, some local solutions, some innovations for that. So even though there may be constraints of the financial or resources, we still need to find out a way. And last but not the least, the political will is most important. Without that, policy changes will not be there and immediate actions on the ground also will not happen. So political will is most important. The political leadership has to understand it, and that is where we need to increase our efforts of awareness, increase our advocacy so that everybody is aware of it. Most of the countries who have democratic setup, there are elections which are taken up periodically. So politicians have to face the elections, they have to face the people. If people become aware and if people demand it, then the leaders will have to provide. So to conclude, we can say that climate change directly threatens the health of the workers, it threatens the safety, and it does it through increased exposure to extreme heat, solar UV radiation, air pollution, and severe weather events. We already discussed them. Then outdoor workers, like agriculture and construction, they are most at risk and they face higher incidence of heat stroke, injuries, and chronic illnesses are seen. Then it also impacts mental health, something which is not really understood properly or don't realize or don't accept, but mental health issues are increasing and climate change is contributing to that. So it creates new or it amplifies the existing occupational hazards. Then workplace mitigation measures are important and effective. And prevention again is more cost effective than compensation. So we always, that is the principle of our occupational health. So it applies in climate change also. So we need to be resorting to prevention. Primary prevention is always the best. So whichever way we can do, wherever primary prevention, secondary prevention, tertiary prevention, all three levels of prevention will apply in case of climate change. And we need to. So these are some references where you can find more information about what I have talked. And then since we have little time, Dr. Abed had requested me to spend a couple of minutes on this forthcoming International Congress on Occupational Health. I'll spend 2 minutes on it, and then we will have the questions that we have on our discussion. If there are any questions or any comments, we'll definitely take them and discuss them. So as all of you are aware, that immediately after the ACOH 2026, which is being held in August. So after that, the next big event or very big event is the 35th International Congress on Occupational Health, or ACOH Congress, as we call ACOH 27. It is being held in India, my city of Mumbai, and it is from 14 to 19 February 2027. It is being held at the most recent newly developed Geo World Convention Center, which at this point of time is a state-of-the-art convention center where we can have 45, 50 simultaneous sessions if required, which generally we need at ACOH, because in ACOH we get very huge response and lot of thousands of people come together. So this center has all the facilities, and as you can see again, that there is a inaugural keynote address which has already been finalized. You can see the names on the website. And then there are 10 plenary sessions. The speakers have already been identified. They're all global thought leaders who are coming and speaking. Then there will be 32 semi-plenary sessions. There will be more than 100 special sessions, which will be delivered by occupational health experts from various countries, including yours and mine. Then we expect more than 1,500 scientific research presentations. There will be free papers, there will be posters and all these things. And then this is also an opportunity for huge networking, because all who's who in occupational health from all over the world will be coming together. Now, for most of us, India is very close. Your travel cost will be much less, and we are taking all precautions and making provisions for even economical accommodation also. Then another promising thing which has happened recently is a metro line connectivity has happened. So the whole of Mumbai city is being connected by metro to this our location, the area where the convention center is located. So we can have better accommodation, cheaper accommodation, and still reach in time everywhere. So to the convention center. So please, the registrations are already open. The last date for abstract submission is 10th of April. That still gives us more than a month. And we will do our best. The organizing committee and the scientific committee have already started working. So please, and then there is an early bird for the low and middle income countries and developing countries. The rates have been kept very low. The rates are even lower for those who are ACOH members. So you can also become an ACOH member. Go to the ACOH website and you will find that. So please log into the website of the Congress. You can see the QR code on your screen. If you scan the QR code, it will take you straight to the website of the Congress. So I expect to meet you all and welcome you all in the month of February. And yes, one last thing, which I had mentioned very briefly. We are aware that a part of the Congress, there will be Ramadan may also coincide with that. So we have made special arrangements for you to break the fast. Food will be provided. And then there will be also opportunities and facilities for prayer. Special prayer rooms will also be available, those who want to do that in the holy month of Ramadan. So with that, if you have any questions about what we have discussed on climate change or even on this conference, ACOH Congress, or anything that you feel, anything related to ACOH, I'll be more than happy to tell you about it. So I have kept my word. I think I have kept to the time, and we can have some discussion if you have
Sure.
Any
Thank you.
doubts and any questions?
Yeah, thank you very much, Dr. Shyam. Okay, there have been a number of questions submitted at the sort of chat box there. One of them, let me just go back and scroll through them again. Yeah, someone asked the question, so what are the likely effects of the current war on climate? I am not quite sure whether there would be any effect on on climate unless it's a huge nuclear war, you know. So what do you think,
Yeah.
Doctor?
Yeah. There is absolutely no questions about that. There will be huge effects. We have already seen what is happening in Ukraine. They have already been affected. And the same thing will happen with the new war, which has unfortunately just now started. That's going to be very adverse effect will be there.
Another question.
There'll be migration, there will be displacement of the people.
Oh, yeah.
And the workplaces will be affected, the power supply, the resources will be affected. People in the war zone will suffer more. And there will be overall the price index will go up. There will be a lot of inflation, which is there, and people will suffer more and more.
Yeah, financially, yeah. Another question here is on the relative humidity. And of course, relative humidity with heat is most uncomfortable, yeah? Okay.
Yes, no questions. In fact, heat and humidity, I'll say they complement each other.
That's right.
There is a complementary effect. And as the humidity increases, and that's the reason we find heat stroke cases even on the sea coast, where the temperatures are not very high, but still there are heat stroke cases because of the humidity. Then there are many industries wherein we see, like for example, the textile industry, where the heat and humidity is already present. When it increases outside, there is a compounding effect inside also. So both of them, because that leads to more dehydration, that leads to kidney damage, and we are already seeing cases of kidney damage.
So that also can affect people with pre-existing non-communicable diseases as well.
Yes.
Okay, another comment here. It says that we have recognized this climate change issue for a long while, but are we really making good progress?
Pardon, I didn't get the question. Yes, it has been recognized.
Recognize the climate change issue for a long time, but are we really making good progress? I think you did mention a bit of that, you know.
Yes and no. Yes and no. Because a lot of people in the world, they joined together. Many countries committed that they will be meeting the targets for climate change. They are publicly committed. The efforts have also been started. There is a focus on renewable energy rather than using fossil fuel. So on one hand, that is happening. On the another hand, we also see some people are becoming skeptical and they don't believe in climate change, and that affects adversely all our efforts.
Yeah.
And then the war also affects.
Yeah. And I think one of the things that we forget from this part of the world is that the climate change concern, not only for heat, but also for lower temperatures, those in temperate countries and winter conditions and all that. And as you can, I'm sure you all have seen the adverse snow conditions over in Europe and US earlier this year. To see that the weather has been really bad in terms of low temperatures, freezing temperatures.
Yeah, you are absolutely right, sir. We have seen this, what happened in California, and we have also seen what happened in other places, including New York, through their cold strikes and infernos, and also hurricanes which were there.
Okay, one last question here from Japan, Mr. Nishizawa. Is there any trackable items that colleagues or foremen can monitor other than self-reporting to avoid overlooking signs of heat stroke in employees working on site? I believe, Dr. Pingle, you did mention some of the things that you're doing in India already in terms of trying to predict or trying to protect or prevent people from getting to a point of being suffering heat stroke or heat stress and so on and so forth. Am I correct?
Yes.
Yeah.
Yeah,
So,
absolutely. Absolutely. So we can have stations. We can look after hydration as a preventive thing. And when it increases beyond a certain time, then we have to compulsorily give rest to people. The work rest cycles need to be improvised further, depending on the exposure, and again, real time exposure.
yeah.
So it should not be something set in from the book. But what is happening real time, if the situation worsens and if it demands, if something is required, then we should be able to do that immediately. So these things are essential. They are being done at some places, but they should be done universally. And that's where the advocacy is important. And we occupational health physicians had to play a very important role in that.
Yeah. Good. Let me see, there any questions? Effect of climate change on agricultural workers. Yeah.
That is
That's a big issue. Yes,
the
I'm
worst
sure.
possible effect is on agriculture workers
Yeah.
because they're all
Out
exposed. They
the
don't have much
open.
protection.
Mm, mm. So
And especially in case of small farmers, that's very difficult.
well, I hope that some of these issues will be sort of shared or, research done in this area in India for agricultural workers. I hope there will be a sort of like a session on that at ACOH next year.
Oh, yes, certainly,
yeah.
certainly. And we are planning many sessions, but the suggestions are welcome and we will definitely respond to that.
Yeah. Again, comment, I suppose, is about a war. War, of course, then brings about migration, and then and because of this migration, they are in poor conditions. Those people who are moving around, trying to find some place to move to, and therefore their health will be affected. Even though they're not working, but just trying to get from point A to B, to safety and all that. These people will also be adversely affected, I assume. Yeah.
Yes,
Okay.
very true.
Yeah.
Very true.
Okay. Since there are no more other questions, as we said before, the recording of this presentation will be uploaded onto our website, and you can always go back and look at it and look through the whole presentation, including the slides and so on and so forth. Yeah. And number two, Shakira, could you? Okay. So Dr. Pingle talked about ACOH 2027. I'd like to just remind all of those who are here still that, ACOH 2026 this year is still is open for registration. Yeah. So for those who like to attend, please do so as soon as possible because the early bird registration fee closes in April. So you still have time to do that to get a better rate for registration, number one. And number two, we are still looking for more and more presentations in terms of oral presentation, as well as poster presentations to be presented at this Congress in August. So please submit this presentation, your abstracts, so that we can consider them for presentation in August. And just as a sort of, I guess, to get your interest, those who present, who get selected, you may be able to win prizes, yeah, for best oral presentation and best poster presentations. So that's that part of it, financial sort of gratification, I guess, in a way. But in addition, your abstracts, which are chosen, will be published in a journal. Okay, so you get, some credit for your efforts as well. And so really, just to remind you again, it is from the 5th to the 8th August 2026 in the city of Kuching in the state of Sarawak in Malaysia. Okay, so for those who have never been to this part of the world, meaning not in the main peninsula of Malaysia, but never been to the island of Borneo where Sarawak is located, this will be a very good opportunity for you to come and look at the variety of life, nature and life on the island of Borneo. Okay, on that note, I should like to thank again Dr. Shyam Pingle for his contribution to this session. And I'd like to thank all of you who are still online, who have taken the effort to attend this webinar. And I hope you have found it useful. You can always contact us to let us know if you think there are certain topics that we should cover. We always look forward to suggestions from our listeners. And now on the screen here, you see the QR code for ACOH 2026. If you can capture the QR code, you can go through that system to do your registration and so on and so forth. Okay. Okay, and the next one is about 2 weeks from now, or almost 2 weeks from now, more than 2 weeks from now. Our next webinar will be on the 17th of March. And here is a very interesting topic to do with harm reduction and job placements, that we are doing in Malaysia to help those who have drug addiction problems. We try to rehabilitate them and try to bring them back into society, so to speak. So this will be done by Professor Dr. Rusdi Abdul Rashid, who has a lot of experience in this particular area, and he's more than happy. I mean, he offered to talk to us or to present to us, what are the efforts that's been done. In a way, one can say, oh, it's not nothing to occupational, but I think it does, because these are people who are already working, who got involved with drugs, and who were caught and punished, and now they need to be rehabilitated. This is talking about the last bit of rehabilitation, in which to allow them to come back into society as a sort of productive member of society. So please take note of that date and the time, which is also at 2 o'clock on 17th of March. And we look forward to hear from you all on that day as well. With that note, thank you. And for the Malaysian participants, the MMA CPD point submission, please use this QR code to register your participation in this webinar. Okay, this is for Malaysians who need these points for your annual practicing certificates. Okay, thank you very much, everyone, and have a nice or good rest of the day and the week ahead. Thank you very much again.